Yes, good morning. It's Ann Lundy calling from Chicago.
Okay, and if you can take about 10 minutes to give us your example and your experiences.
Absolutely. And again, good morning. And I regret that I'm not there in person, but very happy to be joining you via teleconference. So I have spent the past 25 years or so working in the government side from a managed care organization, primarily in Medicaid and then also Medicare populations. And the transportation issue is, obviously very concerning and is a very important benefit for the beneficiaries. Again, irregardless if they're Medicaid or Medicare. And just as a kind of a backdrop, if you will, the Code of Federal Regulations requires the states to ensure that the eligible and the qualified beneficiaries of Medicaid and Medicaid have non-emergency medical transportation benefits. They see, thankfully they see that as recognizing that it's so important to get the beneficiaries to the providers and to necessary services. But it really does kind of, although go beyond just the providers and the facilities, as often too as part of this beneficiary's kind of plan of treatment or plan of care requires them to, and even person-centeredness, if you will, plan of care can be needing to go to other, community resources or food pantries, or other types of coaching and counseling services that it doesn't always, the states do vary state to state by Medicaid, so it doesn't always necessarily cover those services, which is unfortunate. And I think there's room for improvement there. Also, the Medicaid beneficiaries, if they certainly have access to a car, or if they have some resources within their community, that certainly can be a benefit too. Depending upon the member, the beneficiary needs and the state rules, these non-emergency transportation services can be provided by taxi, again, car, if the member has a car, the beneficiary has a car, or a friend, family member, significant other, public transportation, and or subway. As you can imagine, there's issues that come up with all of those modes, specifically around scheduling and the need for the beneficiary to be on time, for certain specific treatments such as dialysis and or radiology services, just to give a couple of examples. Again, the states are required to cover these transportation services. It does vary by state to state as far as exactly what they will cover. Obviously, the geography and what's available does have an impact too on the availability of the transportation modes, and obviously the rural settings can be a bit challenging. So one of the areas that I've particularly had some experience in to try to solve, I guess, if you will, or try to offer some alternatives to transportation is that the ability to use telemedicine. And with telemedicine, and there's a variety of ways, certainly the most simplistic is the actual telephone. But now that we have kind of the smart devices, the tablets, the FaceTime, the various kind of computer modes, we find that we can be creative with it. And from a cost standpoint, it significantly reduces, transportation costs, and it also kind of takes out, the errors that can occur or the timeliness or lack of timeliness. And it can be a very efficient use, too, of providers and clinicians' time. So that's one area on telemedicine is the cost. Also the access. So there can be, again, in more challenging rural areas where adequacy is certainly an issue. It can really kind of assist with being able to get some specialty services or some specialty consultations available for a beneficiary. And then also in many situations it can divert, if you will, from having to go to an emergency room or emergency department by being able to have that kind of site, if you will, especially if you're using the video capabilities of telemedicine. We see it being a positive around quality because we see as a decrease in risk of injury or disorientation for the beneficiaries, and then also being able to really kind of enhance and provide some preventative and some wellness screenings in health exams. Now, also, previously where we might have been challenged with medical documentation, with the emergence, if you will, of the electronic medical record, all of this, even a video visit could be stored in the electronic medical record, which really kind of assists with more real-time visual records, if you will, in regards to the outcome of the visit. And the other thing too is that it certainly doesn't have to stand alone, if you will, telemedicine. It can certainly be an enhancement of an already relationship that the beneficiary has with the facility, with the local hospitals or local clinics or centers, and it just really kind of augments, the plan of care and the treatment plan that's currently in place, and perhaps, too, can solve for some challenges with transportation, either lack of or adequacy, if you will, for the individual. So I will pause there and send it back to you.
Okay, thank you very much, Anne. If you can stay on the web, then when we get to discussion, I'm sure there'll be questions for you. Thank you very much. We next will hear from Perry Meadows, who's the Medical Director for Government Programs at Geisinger Health System. Perry?